Welcome back. So today I wanted to do a video about all of the kind of weird household items we use every day in vet med. I think vet med, and especially shelter medicine, is like a prime example of MacGyvering and using everything at our disposal to our advantage to treat the animals, make them more comfortable, and just kind of solve a lot of the little problems that come with sheltering. To just kind of show you guys what we use and how we use things. Obviously all shelters are looking for donations all of the time, and obviously the biggest ones are blankets and towels, and I never realized before I started working in a shelter how like invaluable they are, especially when I'm working in something like the parvo ward or things like that, where we need a lot of laundry because it gets soiled so quickly, and a lot of it can get soiled to the point where like we should just throw it away. When you're working in a clinic and these animals are seriously injured, critically ill, and like the only thing you can do is make them as comfortable as possible. So bedding is always like the number one main thing that shelters are gonna need. If you could donate one thing to a shelter, it should probably be blankets or towels. But a lot of these things I think are also really invaluable, and they're also kind of something unique. I would also recommend reaching out to your local shelter if you're looking to donate, just calling them up and seeing if there's anything special they need other than blankets and towels, and anything else you can like bring to help with anything specific they've got going on. A lot of shelters have also started doing Amazon wish lists, so you could buy directly from Amazon to donate that stuff, which is also really nice. And I think even if you don't buy from Amazon but you see that they need something and you have access to, like, obviously that's a great place to start. So the things I'm going to show you are not that obvious, and honestly they might not ask for it directly, but I think it's a good way to kind of fill those needs that aren't always filled, and a lot of time they're things that we run out of and then we don't even think about asking to be donated because it's kind of like no one's gonna donate that, but they are things we use like all the time and we go through them all the time. So outside of like fleece blankets and bath towels, another huge thing that's like super helpful is comforters. So like big fluffy comforters from your bed. Those are like really helpful, especially when we have like maybe older dogs, seniors with arthritis, that have a difficult time on the floors. So the floors in a shelter are usually like some kind of linoleum or concrete or something like that that's like easily be able to be sanitized, so things we can just spray down, let soak, and then squeegee away. So a lot of those floors are like super hard on the joints for like older dogs and bigger dogs, and dogs with arthritis, and it's really hard for them to like lay on that just with like maybe a towel and a fleece blanket. So a comforter is like a really easy, quick way to give them an adequate amount of bedding to keep them comfortable and keep it so they are not just like sitting there in pain, even if they're on management for it. Like just the comfort of extra bedding goes a long way. Another thing that I like for coverage and comfort are moving blankets. So not the plastic tarps that you use in moving, but like the really thin blankets that cover furniture on a moving truck. So we got actually a donation of those, and it was so helpful. I couldn't even tell you, I never thought about it before. The moving blankets are good because they're huge, so they have like a huge amount of coverage for the kennels, and it's kind of like you're making a carpet for the kennels, and it was super helpful. I actually ended up using them for these two puppies that had neurological issues and that had difficulty coordinating their limbs and moving around. So on the hard floors they would like go potty, and then it would be really hard for them to move away from it, so they would end up kind of laying in it unless someone could come and like clean them and move them. So if they would just end up laying in it, and then they were continually contracting urinary tract infections from just laying on the wet hard floor. So basically what we use the moving blankets for is we use it to like completely cover it, so not only did they have traction to be able to move away from where they pottied, but they also, like, the urine would get soaked up into the blanket, so it wasn't just laying, you know, wet on wet all the time. And then it was super easy to clean. Just throw it in the washer and spray down the kennel, and it was actually made cleaning a lot easier to have that kind of full coverage. So the next is kind of a duo. It is bath rugs and yoga mats. So these are your bath rugs that have like, you know, carpeting on the top but rubber on the bottom, and then mostly rubber yoga mats. So not only are these providing, you know, padding for the kennel, but they also are providing traction for animals that might have difficulty walking for a number of reasons, whether they've had some kind of surgical intervention where they need to kind of relearn how to walk, whether that's an amputation or some kind of orthopedic surgery, or if they have trauma like spinal injuries and things like that, and they have to do like physical therapy and walk again. It's really helpful to have some kind of tread that we can put down and not just like be holding them up, trying to get them to walk and having them continually slip on the slick floor. So these yoga mats and bath mats really help us do physical therapy for these animals, while keeping it safe for them and keeping our backs safe, and just making sure that they have like a comfortable, solid place to walk when they're trying to heal. Next, we have t-shirts and other kinds of shirts. A lot of the times when an animal gets some kind of injury or wound, it could be like anywhere on the body, and a lot of those places aren't really conducive to like normal bandaging techniques. That bandage could either slip or rub or, you know, create a new problem just from where it is and how it's going to have to be wrapped. And then you have maybe the dog can get to it and scratch it, or the cat can like roll around in the litter and it can get under the bandage, things like that. So a really easy way to cover these wounds other than bandaging is to put shirts on. So shirts are really good for covering the back and the sides, any kind of wound there that maybe they might itch or rub around in. Long sleeve shirts are good if you want to protect like the upper arm or the elbow. Our personal dog, we actually would put longer sleeve t-shirts on her to help her elbow because she was having a wound open up because she kept laying on the hard floor instead of the carpet. She would keep opening up that wound on her elbow, so by putting that little extra padding from just a shirt, it kind of helped minimize the trauma to that area. And so even with, depending on the animal and what you have on hand, you could kind of try to use the turtleneck just to kind of cover a little bit more of the neck. But they are super helpful, and it's any kind of shirt. Obviously, in this video, you've seen us using old scrub tops for this German Shepherd because she had a huge wound on her back that took like months to heal, but it was good because we had like not only coverage from a bandage, but also coverage from a shirt, and it helped her to not like scratch at it. So different shelters have kind of different protocols as far as like kennel locking and things like that. So some places will have lock padlocks on all of the kennels, some will not have any, but a lot of places will have something easy that just clips and isn't really locked, just to ensure that the kennel stays closed and that we don't have any loose dog situations or loose cat situations that can like lead to fights and things like that. So having something that ensures your kennel door is closed is really valuable, and a lot of what we use is carabiners. So I cannot tell you how many times I've had a carabiner save an animal from falling out of a high up kennel because of a janky door. A lot of times, like, you know, after so many uses, these doors will get worn down and they might get sticky, and so having a carabiner to like put through the hole to know that that door is closed is really useful. We also use them to hang up fluid bags. We use them to hang up like kennel cards. At a shelter I worked at before, they would use them to hang Frisbees smeared with peanut butter and treats for enrichment. So it would just hang on the kennel of the door and they would just lick it off. And that was a form of enrichment we used. But you need something stable that's gonna hold it, that's not gonna cause an issue like, you know, a shoelace or something. So carabiners are a really huge thing we use, and we always need them because they can always break too. So another thing I am asking for all the time is what we call high value foods. So these are foods that are not just wet dog food or kibble. So these are things we use mainly when an animal is struggling with their appetite. So you know, in one of my previous videos, I talked about a cat who's only eating canned sardines. So these are things we can use to help stimulate their appetite. And animals struggle with their appetite in a shelter setting for a variety of reasons. A lot of times it can be just from being shut down from being in the shelter environment, being depressed or scared or shy. They might just not want to eat as much. So using these things to kind of help assure them that, hey, this is an okay place. You're gonna get some treats sometimes, but you gotta eat for me still. You know, just kind of helping them know that this is like a good place where they get treats is helpful. But for vet med, the biggest thing we use it for is to help get animals their meds. Yeah, I know we can like pill dogs all day long, pill cats all day long, but if you are in a shelter environment, you're gonna see a lot of really aggressive animals that aren't gonna let you touch them at all. But they can still contract things like upper respiratory infections and kennel cough, and then they need meds. So you really have to kind of get creative as how you're gonna get these animals their meds and get their appetite back when you can't even touch them. And these might be animals that are on bite quarantines that you're not, like no one's allowed to touch them, but they still need medical care. So getting really creative with how we get animals meds is kind of like become a little pet project of mine, just finding different ways to trick animals into eating meds. A lot of the things that I usually ask for are things like hot dogs, canned chicken, baby food, rice, pumpkin, although I haven't had a lot of dogs eat pumpkin. Oh, a lot of cream cheese and squeezed cheese. Peanut butter is really good, but I feel like that's kind of like everyone uses peanut butter for everything, so it doesn't really feel like a high value food to me. But you can definitely use it. I use that more for distraction during like medical procedures and things like that. But squeezed cheese and cream cheese are really good as well. One of the things I had the most success with when I worked at our open admission shelter, we had so many animals that would be on upper respiratory meds and not really eating as much. And one of my main go-tos was like I would cover the pill in cream cheese and I would sandwich it between 2 pieces of pepperoni, and they love that. So that is one of my tips for if you have exhausted every other resource. I would recommend trying that. So we know that just by getting their medicine after a while, their appetite's going to come back. Just because it's going to kind of, if it's an upper respiratory infection, the antibiotics are going to clear the sinuses, make them smell again, so they want to eat again. And then at that point, we can start mixing in like canned chicken into their wet food or putting some over their dry food, things like that, where we can like get them back to eating normally. We are always in need, like we are going through canned chicken in our ICU like nobody's business. We got like, I want to say 50 packs of 4, and we are down to like maybe 10 in like 3 weeks. The next few are more medically based ones that we use pretty much only in the clinic, but we still need them all the time. So the first one is this thing called Caro syrup, which is basically a form of corn syrup. It's usually like a dark corn syrup. And what we use this for is to help treat crashing kittens or puppies. One of the biggest causes of a kitten or a puppy crashing is hypoglycemia or low blood sugar. So one of the first things we do when a crashing puppy or kitten comes in is we try to warm them up, and then we try and get their blood sugar up. So usually ATEC, while they're getting everything else set up for like more invasive treatments, is to put a couple drops of Caro syrup on their gums. That's going to be the quickest way for them to absorb the sugar and get it into their bloodstream. So you can also use honey or maple syrup because those are basically the same. They're just straight liquid forms of sugar, and they can absorb through the mucosa really easily. So if you are fostering puppies or kittens, I highly recommend always having honey, maple syrup, Caro syrup, anything on hand just in case, so you can kind of be a little proactive with that. But we always keep Caro syrup because it's the most shelf stable, and it's the most easy thing we can get to like really get their blood sugar up quickly. So the next thing we use pretty consistently is heating pads. So there are a couple different versions. A lot of clinics have like clinic grade ones that like use water to heat. everything, but we do use the like over-the-counter white plug-in heating pads a lot. We use those a lot because they heat up really quickly, and you can kind of control the temperature a little bit more. So it's not just like bam straight to 100 degrees and you're burning your patient. But it does heat up quickly, and when you have like a crashing kitten, you need heat quickly. The other ones you'll see are these like warming discs that I think you can buy on Amazon, but they're all really easily like sanitizable, and you just wash the cover and they stay hot for a long time. And so it's easy to just like put one, like heat one up right before you leave, put it in there, and you know they'll have a good amount of heat for a few hours without having to worry about, oh, I left a heating pad plugged in. So the final version of this are the ones that maybe your grandma or your aunt make, which are like the bean or the rice sewn ones. So those I really like, even though you're not really able to wash them. If they do get soiled, you kind of have to throw them away. But if you are able to keep them clean, you can reuse them pretty consistently. But I like them because they are a little bit more malleable, so you can kind of like shape them in mostly whatever way you need. And I like them for babies because it provides a little bit more comfort. So if you have like neonates that don't have a mom or something, I think it provides a good like little nesting kind of, you know, soft, malleable situation. And just on top of the heat, they just get a little bit more comfort from it. So we don't really use these at my current shelter, but at my previous shelter, we use them a lot, and my family actually sewed a bunch for us and sent to us, and it was really nice because we could just send one with every foster. So they would have like some kind of heating pad that they could use without having to like go into their own money or worry about whether or not they're keeping their babies warm enough. Those are really nice. So if you have a shelter that wants to use those, that's a great little crafting project for you guys to do too, because they are really highly needed, and like I said, we always need them because if they get too soiled, you have to throw them away. So a new kind of development in vet med is using ear thermometers more. So these are the thermometers your mom probably used on you when you were a kid to take your temperature, just kind of fit in the ear. And so they're not as accurate as rectal thermometers, but more clinics are starting to use them because they're less invasive. So if you just have to do like a regular TPR on an animal, that is obviously fine. These are better because it's a little bit more fear-free, less invasive, and if you have like a muzzled dog who will let you scratch his ear, it's easier to slip that thermometer in than trying to wrestle him and get a thermometer up his butt. The biggest thing for these is even if you have a thermometer, you have to get the caps for it. Just in the kind of knowing what thermometers your clinic uses, and you can buy caps for them because those are a hot commodity. The other thing that we also use is hair dryers. So again, for warming up animals, the biggest thing that we use this for is warming up animals in any kind of thing, in any kind of way. If a dog comes in that has been too cold outside in the winter in like the Midwest or the North, they are really good for like slowly warming up an animal and drying them. So if they are like wet and cold, like we want to dry them off and warm them at the same time. So hair dryers are really good for that, especially during surgery. So when an animal is sedated, their blood temperature or their body temperature drops. So we really want to keep them as warm as possible because that is one of the major complications that can come from surgery is the animal gets too cold while under sedation. So having things like hair dryers and little socks on their feet and things like that is going to keep their body temperature warm enough so that once they're done with the procedure, they can easily come back up to temperature and recover just fine. So the last one's a little bit of a dark horse, but I thought it was really cool, and I hadn't even thought about it until I saw it in action. And I saw it when I worked in emergency, so I didn't really see it in shelters, although I think it could be a huge benefit to open admission shelters, especially those that run animal control. These over-the-counter drug tests. So these are just those basic ones you get at CVS. They're just a urine test, and they test for all of the kind of mainstay street drugs, weed, meth, cocaine. It's gonna test their urine to see if there's any presence of these. So it's really, really helpful when, you have people who are like, I don't know what my dog could have gotten into, and they don't want to tell you. So that was where it was really useful in emergency medicine. In shelter medicine, you could have dogs that are running around a park, pick up something, and then have an episode, and you don't know anything about this dog. So it is really helpful because there could be, these symptoms could be, indicative of a range of things, and it's really helpful to kind of be able to narrow it down to this is what this is versus like just guessing. So these are just a few of the commonplace things we use in vet med to help our animals, whether make them more comfortable, make their recovery process easier, or just helping make the shelter a less scary and less dangerous place. Let me know if you have any other interesting household items that you've utilized for your pets or in your clinic. I would love to know more. I'm always, always about learning more ways to work smarter and not harder. Thanks again for watching, and we'll see you next time.